Hi there. Today we're diving into something that has really been percolating inside of me. It is a fascinating area of mental health and recovery, and that is the connection between our metabolic health, biochemical balance, and conditions like binge eating disorder and ultra-processed food addiction. So today we're going to explore how shifts in perspective, moving from purely psychological models to including metabolic factors, are really opening up powerful new avenues for healing. If you're interested in this, please like this video and subscribe to this channel. Now let's continue. When we think about traditional methods for working with binge eating symptoms, these methods can be very frustrating and honestly may not address the underlying biological or neurochemical basis of the problem. What if conditions like binge eating and food addiction aren't about psychological weakness or emotional distress, but are deeply connected to our biology and metabolic health? And this is the core premise of metabolic psychiatry. So metabolic psychiatry suggests that metabolic abnormalities like issues with blood glucose, insulin, inflammation, or obesity can significantly impact mental health and vice versa. So poor metabolic health, including insulin resistance, is linked to an increasing risk of serious mental illness like major depression, bipolar disorder, schizophrenia. And interestingly, individuals with serious mental illness are also more likely to have metabolic dysfunction. Dr. Shivani Sethi, who is a physician, double board certified in obesity, medicine, and psychiatry, she's at Stanford. She describes metabolic psychiatry as focusing on treating metabolic dysfunction to improve psychiatric health. And I find this fascinating. A key player in this metabolic mental health connection, especially in the case of binge eating disorder and ultra-processed food addiction, appears to be ultra-processed foods. These foods can trigger neurochemical responses similar to addiction. Much like addictive drugs as we know them, they can activate dopamine reward pathways in the brain and can lead to changes in metabolic and neurobiological signaling, resulting in overeating, binging, and disrupted hunger and satiety signals. Let's look specifically at eating disorders through this metabolic lens. Traditionally, conditions like anorexia or binge eating disorder have been seen primarily as psychological disorders, sometimes exacerbated by dieting. Standard nutritional therapy for anorexia often focuses on increasing calories from any source, unrestricted or all foods fit diets, and they prioritize weight gain, oftentimes encouraging foods rich in sugar and refined carbohydrates. And I want to bring in a powerful paper by Norwitz et al. From 2023 called Animal-Based Ketogenic Diet Puts Severe Anorexia Nervosa into Multi-Year Remission, a case series. So this Norwitz paper really challenges the conventional wisdom. So it proposes that anorexia, and by extension other eating disorders, can be framed as a condition where metabolic and endocrinological abnormalities are not just side effects, but potential causes of the disease. So this really contrasts with the traditional idea that restricting any food group is always detrimental. This paper describes cases of patients with severe, life-threatening anorexia who, after failing standard therapy, they self-adopted high-fat, animal-based ketogenic diets. And these patients subsequently experienced impressive improvements in mental well-being, other health issues, and significant weight gain that they maintained for years. And this is striking because a ketogenic diet is, by definition, restrictive in carbohydrates, which seems counterintuitive for a disorder characterized by restriction. However, the patient testimonials reveal a different experience compared to the all foods fit approaches that they had previously tried. One patient felt that trying to reverse his anorexia with an all foods fit diet made his anxiety worse even as he gained weight. But on the animal-based, the high-fat carnivorous diet, his anxiety diminished, he felt he could relax and steadily gained weight, feeling okay about it. Another patient who struggled with anorexia for over 3 decades found that while her physicians promoted an all foods are good approach, it never really helped what was going on inside and only made her anxiety worse. But when she did the carnivore diet, she felt it cured her. She feels 100% in remission, no longer feels the need to count calories, and feels fully nourished. This is amazing. So while these are just case studies and require more research, they raise powerful questions about whether addressing underlying metabolic issues and avoiding highly problematic foods might be key for some individuals with eating disorders. The paper suggests that for some patients, even those with restrictive eating patterns, they might actually be suffering from something akin to a sugar addiction, and standard all foods fit diets could exacerbate this, leading to a sense of loss of control and increased anxiety. So this brings us to metabolic interventions, specifically low carbohydrate ketogenic diets. A ketogenic diet is a low carbohydrate, high fat diet designed to induce nutritional ketosis, where the body burns fat for fuel and produces ketone bodies. Research is now exploring how ketogenic diets can act as a transdiagnostic treatment for various neuropsychiatric disorders. That means it might be effective across different conditions because it targets shared underlying biological mechanisms such as mitochondrial dysfunction, oxidative stress, inflammation, glucose hypometabolism, and neurotransmitter imbalance. So what this is all pointing to is that it may not just be about restriction or cognitive rigidity. It could be fundamentally about biochemical repair and providing the body and the brain with the right fuel and building blocks. Basic tools for biochemical repair can include not just proper food, but also hydration, electrolytes, breathing exercises, sleep, movement and mobility, attention to light and dark as it impacts the circadian rhythm, targeted supplements, social connection. And I don't believe that a one-size-fits-all approach works for anyone with binge eating or ultra-processed food addiction because they'll be in different stages, have different backgrounds, needs, biochemistry, and so forth. And what works for one person might not work for another. And so finding what works for that person can be a process of trial and error. As I consider the future of addiction treatment, I do believe that abstinent-based models grounded in metabolic science are going to gain more traction. At the same time, I don't expect moderation-based approaches to disappear, nor should they. There's room for both. But I see the future leaning towards more personalized, biologically informed care where abstinence from specific problematic foods is not seen as a last resort, but as a viable and even preferable first-line strategy for an increasing many. The emerging field of metabolic psychiatry and the focus on biochemical repair offers what I find to be a powerful and compelling perspective on treating binge eating disorder, ultra-processed food addiction, and potentially other eating disorders. By addressing the biological and metabolic underpinnings of these conditions, we may be able to provide more effective and potentially life-changing interventions. It's about nourishing the body and brain to restore balance and energy, allowing for true recovery and freedom from the struggle with food. What are your thoughts on this connection? I'd love to know your comments in the comment section below. And if you find this video interesting, please give it a like and subscribe to this channel. Until next time.